Hi, my name is Hong Kai. I am the clinic director and chief physiotherapist over at Benchmark Physio. I wanted to talk today about one of the most common causes of elbow pain, tennis elbow, as well as to provide a physiotherapy perspective of how this condition is usually managed. I hope you find the information in this video helpful. Do remember to follow us on our socials on Facebook and Instagram. So the first question that most people have, what is tennis elbow? And basically tennis elbow is outer elbow pain that is caused by overuse and repetitive loading of the wrist extensor muscles. So if you look at this picture here on the top right, basically when these group of muscles are overloaded, it can start to create pain around the insertion site. And this condition usually affects men or women aged between 35 to 54. And even though it is called tennis elbow, it can actually affect anyone from office workers to active individuals. And we find that this condition commonly presents in jobs that involve repetitive motions of the wrist and arm. So jobs like painting, plumbing, carpentry, and cooking. You'll be happy to know that often to diagnose this condition, you do not require medical imaging. It can be diagnosed clinically quite easily. Usually what we look for in clinic is tenderness over the common extensor origin. And that is usually about 2 cm distal. So if you look at the cursor here, about 2 cm further from this bony bump here on the outer elbow. So any discomfort around this region, that would be one of the diagnostic signs of tennis elbow. Often what we'll also do is to put the wrist extensors under stress. So we'll try testing the patient into resisted extension of the wrist or resisted second finger extension or third finger extension to see whether it reproduces pain in the affected area. We also look at whether there is pain when we start to stretch the wrist extensors or whether there is pain with gripping. Usually, if you have all these 4 signs present during a clinical exam, it is very likely that you are presenting with tennis elbow.